Hi, and welcome to this roundtable discussion. We're going to talk about increasing physical activity in patients with COPD. My name is Barry Make. I'm a professor of medicine at National Jewish Health. I'm joined today by my two colleagues, Dr. Casaburi and Dr. Bender. Dr. Casaburi?
My name is Rich Casaburi. I'm at Los Angeles Biomedical Research Institute, and I'm on the faculty of the UCLA School of Medicine.
And my name is Bruce Bender, and I'm a psychologist at National Jewish Health in Denver and a professor of psychiatry at the University of Colorado.
Thank you very much. So in this module, we're going to talk about physical activity in patients with COPD. So, Rich, is physical activity reduced in patients with COPD? Is it only something we see when patients are really far advanced end stage?
Well, we know a lot more about this than we used to, Barry. We now have activity monitors that we can have patients wear for a week and find out what they're doing in their everyday life. And the surprising finding is that even in the mildest patients, we find that activity level was reduced. And of course, it gets progressively worse as the patient's disease severity increases.
What kind of activity are we talking about?
Well, activity is everything you do. It's walking to the mailbox, it's walking to the shopping center, it's walking the dog, it's going to work and back again. It's riding your bike if you do those sort of things. These are all things, and again, the level of activity in these COPD patients is reduced in all of these activities.
So why are people less active with COPD? Is it all related to shortness of breath or something else?
Well, first of all, we have the problem with COPD is you can't breathe out, expiratory airflow limitation. This leads to dynamic hyperinflation when you try to do things. You sort of retain air and you breath stack until you really can't breathe anymore. And this happens in patients even with the milder diseases. What happens when people feel dyspnea in this way? Well, they stop doing things. They become inactive. When they become inactive, their muscles atrophy, and that becomes even harder and harder to do. And this leads to downstream effects like shortness of breath, minimal levels of activity, poor quality of life, and as we'll see in subsequent modules, morbidity and mortality follows.
So patients get shorter breath, and how does that make patients feel, Bruce?
Well, they get very anxious and very discouraged, and it feels much better to just sit and not do anything. But then there's other psychological barriers that come into play here too. It's common for patients with COPD to be depressed, to feel kind of hopeless. They may have multiple complicated comorbidities that add to their frustration and sense of hopelessness, and it's just easier to sit still and not do anything.
You're absolutely right. The risk of death from a heart attack is really accelerated in people who have COPD. So we need to look for comorbidities, cardiac comorbidities, but psychological comorbidities, sleep disorders, things like that that really do sort of interact and, again, contributes to this downward spiral.
Yeah, so the downward spiral has been talked about a lot. It starts with the fact that patients have physiologic airflow limitation. They get shorter breath. That impairs their health status and how they feel. They feel worse. Their activity is worse. And then what's at the bottom of the drain here? What happens eventually?
Well, complete inactivity, disability, hospitalizations, exacerbations, and mortality, frankly.
In the next module, we'll talk more about how to engage patients in this discussion as well as physicians.